So let's start our first case study in this unit, acquired immune deficiency syndrome, and let's try to identify some key features in this case. It's a 29-year-old white male who was diagnosed with HIV as HIV positive 2.5 years ago. The patient started to receive treatment, hard combination of treatment. First, the patient was on zidovudine, lamivudine, and efavirenz, but he developed resistance, so he shifted to another regimen. And notice in this regimen, the patient is taking ritonavir added to the 3 medications he was taking. Why do we add ritonavir? Well, remember, ritonavir is a CYP inhibitor. So when you take ritonavir, you are going to be able to use reduced doses of other antiretroviral medications, and this will increase efficiency while reducing the side effects. Now, the patient is presenting with moderate dyspnea, persistent non-productive cough, and fatigue. Dyspnea, cough, you think of pneumonia. And the patient was hospitalized before for pneumocystis pneumonia. And the vital signs show fever and tachypnea. And the fundoscopic examination of the left eye, again, is a key feature because it shows the fluffy white retinal patches with focal hemorrhages. This is consistent with cytomegalovirus retinitis. So now the patient will have now the patient has these 2 opportunistic infections. Let's do some questions in this case study. Question 1 that deals with the patient's 2 most significant risk factors for HIV infection. We recognize 2 important risk factors in this patient. He engaged in unprotected anal and oral intercourse with multiple male partners for 7 years, and he also engaged in intravenous drug use. These are the 2 major risk factors, and actually these are the 2 major ways of transmitting HIV infection. Question 3. The 2 most specific clinical signs in the physical examination that support a diagnosis of pneumonia. What points to pneumonia in this case? Tachypnea. Tachypnea is a very important indication for pneumonia, rapid respiratory rate, and bibasilar crackles with auscultation. Bibasilar crackles with auscultation, and of course the chest x-ray that shows pulmonary infiltrates. Question 4. What are the patient's current HIV markers? And this is very important. It's not just sufficient to know that the patient is HIV positive. It's important to be able to follow up and interpret the results. So what are these HIV markers in this patient? CD4 cell count has decreased below 200. Now this patient is no longer HIV positive. This patient is now AIDS patient. Whenever the CD4 count drops less than 200, we are talking AIDS now. And the viral load has increased significantly, and this explains when your CD4 cell count goes down, your viral load goes up, because simply now your immune system is not doing its function. So what are the clinical manifestations of AIDS that this patient showed? Oral candidiasis, your immunity goes down, fungal infections will happen. Cytomegalovirus retinitis, again, it's an opportunistic infection. Pneumocystis pneumonia and low CD4 cell count. So these are the manifestations of AIDS in this patient.